the
I'm
correction.
starting now. All right, let's get started. My name is Corinne Waldow. I'm the Senior Director for Economic Vitality at the Boulder Chamber, and I want to thank you for joining us for this week's cross-industry focus on the public health orders. As you know, we have another update. We, as Boulder County, will be heading to the level red, the new high-risk level red, which again has changed from what you heard what that would be last week. So we luckily have our weekly call, and they'll be going over what that will look like as of Friday right here in Boulder County, thanks to our wonderful partners at Boulder County Public Health. Please put all your questions in Q&A, not the chat, Q&A. It's a lot easier for us to be able to sift through the questions. We have a lot of people on this week's call. We'll use the chat to be able to give you links and updated information as we're able to put those through. We're going to try to get through this call in the hour. We're recording it. We will have a Friday update as well if anything changes, but also to get through some more questions as they come up as we head towards this level red on Friday. I'm going to hand it over right now to Jesse Rounds.
Thanks, Corinne, and thank you everyone for jumping on. I know that these changes are difficult. So I'm going to try and run through the beginning of this as quickly as possible so we can get to questions. So just jumping right into the epidemiological data, this is our number of new cases, including probable cases, and this is from Tuesday. As you can see, there was a drop off on the 16th, but that was, I think, partial day data at that point. But generally, it does appear that we're down a little bit from a peak, but we are still experiencing an incredible spike. And so we're watching this, intrigued to see how it's progressing. But as you'll see when we get to the metrics, we are definitely in the phase where we should be moving to these more restrictive levels. Also wanted to just again highlight one of the details here. The hospitalizations, they're down a little bit, and I do want to remind you that we have the situation where there are two different ways of tracking hospitalizations. One in terms of just straight number of hospital beds in the county, and then there's the second part, which is how many residents of the county are in the hospital. And so those are the two different ways that we in the state measure hospitalizations, and that's why you see some difference in the data. So the key takeaways for this month, we are still seeing rising case numbers. In general, the trend is still rising, and the rate is increasing rapidly. That's the biggest concern. As yes, we see an increasing trend, but the rate is also rising. Hospitalizations are increasing statewide. Again, this has just been the last couple of weeks we're seeing this still. And a question that's come up in the last couple of weeks, testing is stable. Our testing numbers have pretty much been the same for quite some time, but our positivity is rising. So there have been a lot of questions about, well, is it because we're doing more testing? No, it's not because we're doing more testing. There is community spread of COVID, and that's where we're seeing these numbers from. So this dial is the old dial. We are still at level 3 high risk. We are moving on Friday, according to the state at this point, to the new red, which is the severe risk level. And I'm going to go over our numbers right now, and then I will go into detail on the new high risk level or severe risk level. I'm not going to spend much time on our current level. So right now we're at 758.9. This was as of Tuesday, 758.9 cases per 100,000. That's pretty much what we're seeing across the metro area. And for those who are interested, Weld County is at over 1,000 cases per 100,000. So in terms of 2-week positivity rates, we are at 8.3. I've seen an updated number that puts us a little bit higher than that, but We are, again, a little bit lower than the rest of the metro area. And then finally, hospitalization status. Again, this is that thing where we're seeing a rising number or hospitalization. Our hospitals are seeing a lot of patients, but in terms of the number of residents of the county, we're at stable or decreasing admissions. Okay, so this is where, switching gears, where I'm just going to jump right into the severe risk, and we're going to go sector by sector, and I'm going to try and hit all the points, but I'm going to do it relatively quickly, so please ask questions. I want to spend more time talking with all of you than presenting. So as of now, we have been told, and it has been released to the press, that Boulder County will be moving to the severe risk level on the dial. This is the new red. There's now a purple replacing the old red. And one thing I want to point out that has to do with sort of the layering of guidance and restrictions, at all times, the most restrictive or the more restrictive order applies. So if the county has a local order that says something that's more restrictive than what the state does, our order applies, and vice versa. So starting right out, public and private gatherings of 2 or more households are prohibited. Non-critical office-based businesses must operate at 10% of their posted occupancy. Again, this is a change. Last time it was the number of desks. Now we're back to your fire code capacity. I don't know why that changed. Maybe they figured out that it comes to the same thing, but please check your fire code capacity, check with your landlord. There are some ways to sort of calculate it online, but it's not really very effective because there are a lot of local restrictions that it would affect fire code capacity. So please check with your landlord, or if you are the landlord, it should be available in your documentation for your property. For critical and non-critical retail, 50% of posted occupancy. Now, this is an important detail. Under orange, you're at 25% of your posted occupancy. Under this new order, you are at 50% of your posted occupancy. The order also recommends that you look for enhanced curbside or online services. So that's a really important detail that I want you to, that I think is a significant change. In terms of non-critical manufacturing, this is the same as under the orange, 25% or 50 people. It may have actually been 25 people, so you may actually have more people in this one. So for field services, the field services guidance here says closed except for all necessary services to maintain the safety, sanitation, and critical operation of residences and critical businesses. So snow removal, those sorts of things need to be able to continue, and they are allowed. In terms of real estate, open houses are not permitted, but individual real estate showings may continue. Again, following social distancing and masking guidance. For personal services, they are the same as level orange. Limited healthcare is the same. Indoor events, there are no indoor events permitted under this order. Outdoor events may operate at 25% of the occupancy, not to exceed 75 people. This is a great place to use the social distancing calculator to figure out what your occupancy for an outdoor space is. And you do need to maintain 6 feet between households, and you need to limit the amount of interaction between households at those events. Restaurants, and this is a lot of information, and there's been a lot of confusion and sort of back and forth on this. So I'm going to tell you what we understand, and then we can talk about it at the end. Restaurants, as of Friday, indoor dining is not permitted. You may offer takeout and delivery if you don't have outdoor spaces. Outdoor spaces that are licensed operations by your local authority that would be your municipality in most cases, may continue with 6-foot spacing between your tables. Alcohol sales on premises, that consumption must stop at 8 p.m. No more sales after 8 p.m. Takeout orders for alcohol, pickup orders for that may continue until 10 p.m. There is no limit on the amount of time you are allowed to be open for outdoor dining and for delivery and takeout. It is just alcohol sales that are limited in terms of time. For houses of worship and life rites, houses of worship can operate at 25% capacity indoors with no more than 50 people, and outdoors you must maintain 6 feet of social distancing. And it does say that you need to contact us in order to establish the capacity for outdoor spaces. And please do that. Get in touch with us, and we can talk about how that would work. The asterisk there at the top for life rights, the order does say that life rights scheduled for this weekend, so through Sunday, are permitted to continue at level orange capacity. So if you have a pre-scheduled life right, it may continue, but after that, no, you need to go under this guidance. For recreation, gyms must operate at 10%, not to exceed 10 people per room indoors. And reservations are required for all indoor and outdoor services. No organized sports indoors, adult or youth, and that includes practices of any kind. And recreational sports may operate outdoors at 10 people max per game with social distancing and masking. Outdoor guiding activities can continue at 25% capacity, not to exceed 10 people, and children's camps, which seem increasingly difficult to pull off, no more than 10 people and outdoors only. This is a thing that has been coming up. This is broad, this is in the order, and I just want to reiterate it for everyone. This came up last week as well. Critical businesses must follow sector guidance for capacity and other requirements, unless doing so would make it impossible to carry out your critical function. So that's the guidance from the state on critical businesses. And just to close out here, we need to keep requiring mask use. We need to follow state guidance, wash hands, socially distance, and those group gatherings. Now that we're down to no group gatherings, I would go beyond limiting and just say don't do it. Even your events, trying to limit the number of people at events is really a great way to reduce the chance of spread. The exposure notification system, really great tool. Please sign up for it. And just want to remind everyone, we have a retail business call at 4 o'clock after this. I'm sorry, we're limiting the time for this call, but we are going to have that additional call at 11 a.m. on Friday. And with that, happy to take questions.
Okay, so first off, this order takes effect at 5 p.m. on Friday. So that's one of the questions was 5 p.m. on Fridays. So I'm sorry to the restaurants that is just before dinner service. So that was one of the questions. One of the questions are from restaurants: are customers allowed to come in to order food and use restrooms? They're just not allowed to dine in. Those are some of the questions from restaurants about customers coming into the restaurant for those types of services.
So the order doesn't speak to that. I don't know, Lane. I would restrooms, I feel are that's a public health thing. So I think that should be permitted. But I don't know about the ordering. I don't know if Lane, you have any insight on that.
Just specifically prohibits indoor dining and allows only curbside takeout and delivery. So doesn't really speak to that you are still maintaining a public restroom or anything like that. But no one should be congregating. They can't be served alcohol or drinks while they're waiting. there's no service inside. So they strictly need to come in, pick up food and leave.
Okay. On the outdoor dining, is there a limit to still 10 guests from a single household? Because we know that you can only eat from a single household. We know that that used to be from 2 households, but now it's a single household. Is it limited to 10 guests from a single household that can dine together?
Yes. Yep. So it's single household, 10 people outdoors.
And are there limits? Is it just space limiting as far as how many people can dine outside? It's just based on making sure you're maintaining a good 6 feet between patrons and the space allows the tables?
Yes, exactly. And I like that description of a good 6 feet. It really needs to be so that when both patrons have their chairs pulled back, they're still 6 feet apart.
Okay.
And just to proactively talk about tents, tents that have 4 walls and are fully enclosed are still considered an indoor space. But if there's 2 walls open so that air can blow through, that's considered now an outdoor space.
Okay. Can you explain why there was an increase from 25 to 50% for retail? If you're curious, people are curious about that.
No.
I've heard a little bit of reasoning on it, but if you guys have anything.
No, I can't give you that. And I would just say that they actually increased orange and red. So everything is 50% for retail at all levels. So it just is encouraging curbside for orange and red. And
yeah, they were trying to look at some of the science and the data, and they did increase the retail. They did increase the retail percentages. Looking at the gyms side of thing, in regards to the 10% or 10 people in a room for gyms, is this similar to the 25% and 20, whichever's less?
Yes.
That 10? And yep. That does not include the instructor, correct? I read in the order, it does not include the instructor.
That is correct, yeah.
How does this order affect locker rooms?
It does not speak to locker rooms. So whatever your existing locker room policies are, I mean, I think the one caveat would be you will need to figure out a way to limit the number of people in that room to 10 people at most.
Okay. If there's spacing for 10 people, if it's a small locker room, then
it's a small locker room, yeah.
Yeah, I've seen some of those locker rooms. There's no way there's enough room for. Okay, so if you have a really large gym and you have a divider in that gym, can you explain what kind of divider makes it 2 separate rooms?
Yeah, Lane, go ahead. You had it.
I'm just going to come back to the locker room. So it's 10% capacity or 10 people, whichever is fewer for your locker room, for your classes, for any of the spaces in your business. And I guess I can answer that other question while I'm talking. So,
well, and what the question is, gym space is 4 walls and a door, and what constitutes a wall?
It has to be an impervious barrier. So it can't be a cloth or something that, it needs to be a solid barrier. So if there's a divider that's pulled, that's a solid divider that can separate it, but not a cloth or mesh, kind of a curtain between the spaces.
In this case, there's airflow that goes around the sides and the top. That's not considered a wall. Can we talk a little bit about the reservations required for gyms? Does the fact that members check in and out, is that acceptable for reservations, or do people have to literally call in advance and know who's coming beforehand for a facility?
So it doesn't parse that in the order. I would ask that people follow that, and so that you tell members that they need to call ahead and let you know that they're coming. However, I will ask that question and see if a membership base where you check in and they have a record of that is okay.
Yeah. I think the question from some of the gyms is, is this about contact tracing? Because if you know who's in the gym at any time, whether or not that's about it, or if it's about making sure it's not, you don't have people convening in a location at all times you're not going to have more than 10 people. If it's about that, then maybe that's about making sure you have no more than 10 people at the location at a time. Maybe that's the reasoning behind the reservations.
I think it's to control that you don't exceed the potential for having that many people showing up at the same time. So just signing in is not a reservation system. They need to actually manage that people are arriving, and you're not going to have more than 10 people arriving at any given time. So
you don't have 20 people
create,
show up and you have 10 people going, I'm sorry, you can't be here because we're over our capacity. Then you're having 10 people convening in a space, and then at that point, you're probably you're going to be putting people at risk.
Yeah, how you want to create and manage your reservation system is left completely to you, but you can't not have one and just let people show up and deal with it as they arrive. So
okay, so question about swimming and swimming pools. How do pools relate in this order?
So swimming pools are a room inside a gym. They need to be at 10 people or 10% of capacity, whichever is less.
Okay.
Same for outdoor pool.
Yeah.
And then lap swimming.
Lap swimming can continue at, I mean, there's no change between the order at orange and the order now. So lap swimming can continue, again, reservation based, and,
6 feet of social distancing.
6 feet of social distancing.
So family swim, lap swimming, water, those types of things, but you have to have reservations. It needs to follow those same orders, and then make sure you have 6 feet between the families. Okay. So tennis clubs. I'm going to keep with the recreation since we're on that. Outdoor courts for tennis clubs. They play 4 on a court max. Do the members already make a reservation? They play 4 on a court max. You want to talk a little bit about how those 4 can, do you want to talk a little bit about tennis and how those 4 can be made up if that's a gathering? They have to make reservations, how many people they can have.
So, I mean, this is an interesting question because is this a group gathering and thus not permitted even under that? But I would say the recreation guidance clearly states that outdoors you can have 10 people playing a sport recreationally. So an outdoor court, you could have 4 people on a court as long as that's, as long as the space available. And I haven't played tennis in long enough that I don't know what the dimensions of a tennis court are. But if you can fit 4 people in that space and make sure that they remain socially distanced, that's the hardest part about all this. Is I don't know how you make sure that your doubles partners don't get too close to each other.
I don't think you can do that unless they're from the same household. So if you're going to try to play doubles, they have to be the same household on the same side. Otherwise, you need to play singles. So there would be no way to have 4 different people from 4 different households playing doubles together.
Yeah. So you might be able to play one household against another household.
Yes.
Because you'll be able to maintain 6 feet of distance between the households.
No crashing the net, please.
Yeah, I played doubles unless there's no way. It's been a while, but it'd be a little hard. All right, so we have a couple museums and art galleries on here. Represent a museum. They know that the retail part maintains the retail capacity. The restaurant part would be closed.
Yep.
The retail capacity would do the contactless experience for customers, masks in the building. They could still be open under the retail capacity, correct?
In their retail spaces, yes, correct.
Okay. But the museum, because we had talked about the museum being more of that indoor event type space, would have to be closed at this point.
Yes.
Okay.
Yep.
So it's same thing with a nonprofit art gallery. The gift shop part of the art gallery would probably would fall under the retail component.
Yeah, I mean, that's an interesting question. Is the art gallery, if that art is for sale, that's a retail space, I would say.
Okay,
They would have to follow all other retail guidance, though.
all the retail guidance. So making sure to look at those, the plexiglass at the registers. So there's a lot of pieces to that retail guidance, single flow traffic, um, you know, reminders, just more than just capacity limits. I think
Yep.
we're concentrating a lot on the capacity limits here, but we have to go back to that original guidance and making sure there's pieces to that. And there is a retail call after that.
Yep.
Do indoor holiday markets, what would be limitations on those? Would the 2 household limitation apply, or would it still fall under non-critical retail?
I would think it falls under non-critical retail. The one caveat I have, and I'd be interested to hear what you, Corinne, and Lane have to say about this, with multiple vendors, I guess that shouldn't matter. You have a retail space as long as all of the vendors are complying with the retail guidance and the larger spaces complying with the retail guidance. I think it's possible to go forward with at the 50% of capacity.
Yeah, I would agree. And you're going to have to look at, again, what the available space is. So probably the space calculator or something based on, 50% of that occupancy, so you can really make sure that there's still availability for people to flow and not have to be on top of each other. They can socially distance.
Okay. All right, so back to the family swims. So just making sure that a family swim, as long as they're socially distanced, is not considered a public gathering, because they're not coming together. It's families that are swimming as a family in the pool, separated.
So if you're in sort of one of the, at say a rec center, the pool area that's there for recreation, not for lap swimming, I don't know how you maintain 6 feet of distance in those spaces. Those people would people in the pool that are not related would need to maintain 6 feet of distance at all times.
You're only allowed 10 people, so we're not going to be able to allow much more than a couple families in there to begin with. So, but it limits to 10 people.
And I would also say in a lot of cases, at least in my experience in the area, those recreational pool spaces are in the same room as the lap pool. So that's a total of 10.
Yeah, total 10 for the whole pool.
Right.
Okay.
The whole room.
Yep.
The whole room, because that's 4 walls and a door, and the pool is, you don't have a divider in that room.
Yep.
Okay, pickleball, open gym, the basketball courts, all that were considered personal gatherings if not led by an instructor. So those pickleball, are they now prohibited?
Yes. They would be, well, again, if you had to sign up for it, then maybe you could make it happen.
No indoor sports, though.
But no indoor sports, right?
So,
I think that means no basketball.
No indoor organized sports.
Yeah.
But if I wanted to go get a basketball myself and play by myself on a hoop, if I've done a reservation, I go get a basketball and I go play basketball by myself or with my husband who lives under the same roof as me, I can do that if I've made a reservation beforehand.
Yes.
Okay. All right, a recreation facility greater than 30,000 square feet with 5 indoor bubbled tennis courts. Reservations required. They have reservations and 10 minutes early. They limit the number of people per each of those rooms to, they've limited the number of people. They've, followed all the things we've talked about. They're not given any variances, are they?
No, they are not.
Because one of the things about being at level red is no variance given. Doesn't matter what size.
And we didn't have any variance capability under orange, just so that is kind of clear that stops once you leave yellow.
Okay. The no indoor organized sports, that's not a Boulder County rule. That's being at red, right?
Yes. Yeah. Well, and that was at orange as well.
Last week you said, Jesse, you said retail for museums was only in the gift shop. Is that correct?
That is, yes, that's, people are remembering what I said. Oh boy.
It's also on video, so if you want to go back and listen to it yourself too. All right, hotel operations, there has been no change to hotel operations, correct?
That is correct.
Except for events.
Right.
Because
Not permitted
last week they could have one event within their indoor facilities. Now they can have 0 events within their indoor facilities.
Right.
Their bar would be closed if they have a bar. Restaurant would need to only have outdoor. So those components within a hotel are potentially changing.
Okay. There's a question as to whether or not Boulder County is collaborating with Weld County on specifics. Now, Weld County is not moving to red. Weld County has not been moved to red, but there is a question about the collaboration with Weld County. Can anybody speak to that? I'm trying to go through these questions as quickly as possible. There's like 100 of them.
I'm not sure if there's a specific component to that.
I think we're talking Longmont, Erie, those areas that are right on the border.
Yeah, we have a lot of coordination with all the municipalities that are in Boulder County that may also have some of their land that also goes into Weld County. And similarly with our school districts, so St. Vrain Valley School District is in multiple counties. So we have a lot of coordination with all those entities.
But just for people's knowledge, there were quite a few counties that moved, but Weld was not one of them. So that is going to be a slight difference. Let's talk a little bit about field services. We know that real estate, you're allowed to have individual showings, which is a change. That was a change that was made because originally the stay-at-home didn't allow any showings. It just allowed transactions. The question though is, can you have real estate listing appointments under this? So meeting with clients to list a property because it just calls out showings. Is that a transactional under the critical is that under critical functions?
It's not listed under critical functions. I would say that we can find out, but I would say unless it's called out, it probably is not permitted.
So if that's something that can be done on possibly online, I don't know. There is also a question as to whether or not carpet cleaning is considered one of the field services that is seen as essential or necessary.
I don't think that would qualify.
Nope.
Unless there is a spill of, unless there was something that was like a hazard or necessary cleanup that was necessary. Okay.
Right.
If it was necessary to maintain the safety of a critical operation, then yes, but not just.
And even like cleaning services, if there was a facility that had some sort of outbreak or needed a cleaning, deep cleaning because of some sort of COVID related or something like that, that might fall under that category. Dance classes, what category do those fall under?
So a dance class would be like a gym, so 10 people or 10% of the space, whichever is fewer.
Not including the instructor.
Not including the instructor, yes.
Okay. How will this affect ski resorts?
So ski resorts should have a plan in place approved by the county that they are in. And part of that is planning for if they have to go to a lower level. But generally, uh, again, outdoor recreation is not directly impacted by this. It can continue at some level. I think the difference will be that indoor spaces will be impacted. Obviously, the restaurant would need to be closed, and any function spaces would need to be closed.
All right, so there's a question about the tenting guidance. So I'm going to put in the state rules around tenting into the chat as to what classifies indoor versus outdoor space. Now, tents technically are more considered those solid plastic walls. There is a question as to why those are considered walls, but a fabric drop down isn't considered a wall in an indoor space. But I'm putting in the actual state guidance as to what's considered indoor outdoor so people can read it themselves. Because I know there are a couple facilities that have put up 4-wall tents thinking that's outdoor space that is actually considered indoor space and would have to close down as of 5 p.m. on Friday.
So, and I'll quickly answer that. You know, obviously it's a risk management decision by the state. Outdoor dining, you take your mask off. When you're playing basketball indoors, your mask is on. You know, there are differences in the airflow in a room as opposed to an outdoor space. So there are a lot of different, like the walls around a tent are very different from the walls inside than a fabric wall inside a gym.
So,
sorry.
No, I thank you for answering that, and I'll mark it off. There's a question about the Spanish language sessions that are on here. Those are not live. Those are tape recorded, and we then release them via tape. There is a restaurant session tomorrow evening, and that's on the Latino Chamber site. There will be a restaurant session tomorrow evening for the Latino Chamber, but they do a taped version of this without questions on Thursdays that then I release to all businesses at the Spanish recording. So people were looking for that. We don't do that one live. There will be a restaurant one this week. So there were 4 questions about that. We'll get that information and the tape recordings of that. So the one for tomorrow is on the Latino Chamber site. If anybody is looking for it, it's latinochamberco.org for the restaurant session tomorrow. Somebody asked if they can have this PowerPoint. The answer is always not unless I get legal approval. So we will get you the recording of this presentation. And I usually try to get you the links that are in here in the email that I send as a follow-up with the recording to this. We tried that a while ago and they usually slim it down on us. All right. So the question about office, can you clarify how the 10% and minimum basic operations work together? So if I need to make sure that I'm meeting the minimum basic operations to do the things that keep my business going, does that have to fit within the 10%? How do I make this work?
Yeah, so your minimum basic operations do need to comply with the order. You know, if you're in a situation where you cannot maintain minimum basic operations and meet the order, you know, I think a conversation with the county and the state might be in order. Are you a critical business? If you are a critical business, you know, your first step is, can I meet the order? If I can't meet the order, how do I meet all of the parts of the order that I can while, you know, breaking some of the rules, basically. You know, the idea there is you need to do everything you can unless it is impossible for you to function at these restricted levels.
And I guess I just want to clarify that critical business, critical government functions do not have a capacity limit. There are other requirements that they need to follow, but they're not specifically held to 10%, 25%.
It is recommended though, so that they're supposed to.
They can continue to operate without the capacity limits, but they need to follow what's listed in section, Roman numeral 3B and C. So I can post those specific pieces in the.
And even if your office space has individual offices for everybody, I have 7 individual offices, they can close their door. I am still limited to the 10%, correct?
Yes, absolutely. Yeah.
So that's, and if 10% is 0.8 people, there's some, and because that might be maybe why they went back to capacity of fire code because of some of these rounding issues.
Mm-hmm. Mm-hmm. Yeah, if I would say, so last time and the last 2 weeks we've been saying round down, but if you have to round down below 1 person and you need 1 person to operate the office, you can have 1 person. At that point you're at 1, and that's like having a room. You can have 1 person in a room.
Okay, so there's a question about, list of critical businesses. I'm going to put the order in. It is the order in the chat. It is.
I just posted that.
Oh, there you go. You posted it. It is Appendix A. So Appendix A lists all the what's considered critical businesses. So there is 2 questions that kind of stick to the same thing, but I'm going to start with the first one, which is, are we in stay at home or safer at home? And I think it gets to the second question, which is the email said that, instead of a full shutdown, they're doing a more surgical approach, which is this creation of the red, then purple, which red, then purple level, which is that new dial level. So we're technically moving to a stay at home, but it's a more surgical version of a stay at home, and instead of a complete shutdown, it's keeping some things open a little bit more.
Yeah, the dial has been changed. So what you were familiar with that Jesse's been showing for weeks and weeks has now been replaced to, there's all these different levels of color. So we are level red, severe risk is what category we're moving to on Friday. We're right now in level orange, high risk, and they've added this new color, level purple, which is extreme risk. So if you're thinking in terms of stay at home, that is more likely fitting there, but the dial has changed. So it's just a new nuance that's unfortunately a new thing that we all have to kind of learn and get familiar with. So it's really just about what color stage we're in and what's allowed. So under red, which is severe risk, for the most part, there's nothing that's fully closed other than some of the indoor activities, but restaurants can have outdoor activities. Under purple, that's where pretty much everything is closed. So that's more of the stay at home.
And then under the old red, personal services, retail, all of those we're going to have to shut down, except and there were some adjustments made. And what they did was they tried to look at some of the data as to where spread was, and a lot of the spread was in the indoor personal to personal contact. So trying to look at the nationwide spread data is what we've been told. And so that's, I don't know if that gets to the question as to the whole surgical approach being less of a, we're shutting everything down and trying to, to try to take away some of those, those cross family, person to person, close exposures.
So a high risk exposure is being around somebody within less than 6 feet for 15 minutes. So when you think of a lot of those settings, that should not be occurring. So as well as limiting the occupancy so that people have an ability to move past each other. So again, those settings don't present the same risk as where people are staying in the same proximity for 15 minutes or longer over a 24-hour period, which is even a more challenging piece. So again, people that work together that frequently interact throughout the day can still be a high risk exposure.
Again, if you have your hand up, I'm not going to be able to let you speak. We have a lot of people on this call. There's a confusion about critical services. If you're not a critical service, doesn't necessarily mean you have to close. It just means that you follow it as you. If you're not a critical service, you follow the orders under your specific order. If you're a critical service or a critical retail or critical manufacturing, your capacity limits are a little different and you follow it a little differently. And see if you could talk a little bit about that, because there's just a little confusion about that. Someone was like, I'm not in here on critical. Does that mean I have to shut down completely? No.
Sure. Yeah, that's absolutely right. Critical, the idea behind the critical business designation was really a follow-on from when we were under stay-at-home back in the spring. Those were businesses that were allowed to stay open. And that designation has continued because there are certain situations where critical businesses need to operate slightly differently than non-critical businesses. The way that the order is written basically says you need to follow, if you're a critical business, you need to follow the guidance for your sector unless it is impossible to operate under that guidance. And that also includes following the protocols if and when you have a sick employee or an employee who had close contact. So basically, what it does is identify specific businesses that under stay-at-home might be allowed to stay open at some level, and then the other part of it is it allows some flexibility for those businesses in order to allow them to stay open, regardless of capacity, or if they need to have more people than their capacity would normally allow, that's permitted because they're a critical business.
Okay, just trying to get through some of these. So organized sports aren't allowed indoors, but lessons, clinics, training, like physical fitness.
Yeah, so training is not allowed.
Not training, yep. Physical fitness, clinics, yep. Lessons.
If it's a class and you can maintain 6 feet of distance and everyone can wear a mask, then it is permitted at 10 people or 10%, whichever is fewer.
Someone asked if we could link to the updated recreation on the state site because it's outdated, but the state site will be updated on Friday once they go. Technically, all of this doesn't take effect till Friday on the state site, so they're going to update their sites on Friday with the new information. There's a question as to, the difference between gyms and retail, and why retail, there's a lot of people moving around, but I think it's that lengthened exposure, 15 minutes within 6 feet.
Yep. It's
exertion.
Yep, exertion. It's all of those things, but I think definitely probably the biggest thing is the likelihood is you're going to spend half an hour, 45 minutes in the same room with a bunch of people. Whereas if you're shopping, you're moving around. Also, it's something of a recognition of the fact that generally in retail there's been more mask compliance than there has been in gyms.
Okay, so do we have any idea how long we'll be in this phase?
Yeah, that's an easy one. Not really. We will be at this level until we can go back to orange levels of the 3 factors, and that we can maintain that for 2 weeks at least.
Okay. So really quickly, the executive order around school pods of 4 children and 1 teacher has not changed, correct?
That is correct, yes.
Okay. We still have like 45 questions. I'm trying to get through them in 11 minutes. Houses of worship, can you clarify if the cap includes staff?
It does not include staff, and it is the entire building, not by room.
Okay. And whoever asked about my son, he's still showing no symptoms. He's still in quarantine.
Good to know.
I appreciate that. I appreciate whoever asked about him, but still locked in his room. All right. Whew. All right, an ice rink. their max participants is 10 people on an ice rink as well.
Is it outdoors?
It is,
Either
doesn't
way.
say if it's outdoors. So tell me indoors versus outdoors, and does that include an instructor?
So indoors would be 10 people or 10%, and it does not include an instructor. Outdoors would be 10 people.
Pre-registered beforehand?
Yep.
Indoor ice rink, indoor ice rink.
Yep. Indoor ice rink. Yep. 10 people or 10%. Instructors not included. Classes are okay. They need to be pre-registered. Yeah.
Okay. Personal services have not changed, correct?
Personal services have not changed.
Okay. You can stay open, continue doing all the cleaning, all the stuff you've been doing.
Yep.
All right. Continue doing wearing the gloves, when you're asked to wear gloves. There was a question about that. That's why.
Right. So the gloves, I saw that question. Definitely check the DORA website, Department of Regulatory Agencies. If you are a licensed provider of these services, they have guidance about exactly how your industry's rules around gloves.
Okay, so acupuncturists, massage therapists, check your specific DORA industries to see. But in this particular chart, there weren't any additional guidances put into that. So let's go back to the original guidance, the DORA guidance. But your capacities have not been impacted, which is good news for personal services, because last week we didn't have good news for you. AA, NA, all of those support groups, how does this impact those? They could do them online, but they're not as effective
Absolutely
online.
So we are asking about that. We recognize the incredible importance of those services, and the order is silent on that specific service unless, I have not seen it listed as a critical service. However, we are asking, and I will try and get you an answer.
Okay. I don't know if you want to go into detail, but what does purple really entail?
So I don't know. I have not read it, and I think in the interest of time, let's focus on red for now, and maybe we can talk about it on Friday.
And I posted in the chat the summary chart that shows the green, blue, yellow, orange, red, and purple, so people can look at that for your specific sector. That's early on in the chat if you scroll way back up. So that shows what purple. And then I also posted the order, which that fully explains the actual law that in language terms spells out all the purple components too. But largely everything needs to be remote or is not allowed outside of the critical services.
Okay. So everybody, people are like, wow, the last week the office workers was based on the pre-COVID employee numbers, not fire capacity. Now it's capacity limits. Can you clarify? This has jumped back and forth, and I think we've gone through this a little bit. It's it keeps changing, and I think it's 10% of 10% of 9 desks is 0.9 people. So I think they're probably trying to take that into account a little bit. We're going to try to, we'll just need a person to do your operations and need a person to come in the office. What you're trying to say is bring that one person in. We are a critical business going into occupied homes and rental properties. We wear masks and booties and ask owner tenants COVID-related questions. Have the requirements for this type of indoor flooring installations and measurements changed? Now that is field services, correct? So are they?
So I would definitely check the critical business definitions. There's information in there about construction services, floor installation, that sort of thing. I don't have it off the top of my head. I don't know if.
And
I posted the order again, so if you go to that, you can read the definitions as well as the Appendix A, which walks through the pretty lengthy list of all the different things that are considered critical types of business.
So, so Todd, if you want, we can talk offline if you'd like to. You have my cell phone number. If you want, we can walk through the Appendix A at some point if you need. All right, we have a lot of questions about the essential versus non-essential. Again, Appendix A of the order. We've posted the order a couple times in the chat. I will send it out. The question is, can I send out this video, the order, and all of that before Friday? I will try to send it out this evening or tomorrow morning as soon as we get it uploaded so people have it. If personal services has a retail order, do they follow the 25% capacity or the 50% capacity?
A retail, or I'm not sure if they have a retail space, that space can be at 50%.
But they just want to make sure that they don't have an intermixing of all their spaces and.
Exactly. Yeah. I mean, I would say that your retail space, if your retail space is separate from your service provision space, then your retail space can operate at 50% capacity. But I also really want to encourage people to figure out ways to not have people in those indoor spaces. Indoor spaces are 19% more likely.
And the question about sort of those support services, human services, those are listed as a provider of necessities to, especially to economically disadvantaged populations. So anybody who's providing some of those critical services potentially do qualify. So they just need to read that section to see if they meet that definition.
So there's a question about office capacity for critical office spaces. Now, I think you need to clarify, is there such a thing as a critical office space?
There may be, yeah.
Is that considered critical office space, or is that office is office? Is there critical office?
So there are critical office, I mean, so for example, defense industry services are considered critical, and they happen in an office, like some of our defense contractors, for example. And so they are an office-based business providing a critical service, and so they need to operate under critical business guidance. Again, the goal is to have them limit capacity, wear masks, clean surfaces, limit gatherings, all of those sorts of things, unless it is impossible to carry out their critical function. It's not just impossible to be in office, it's impossible to carry out your critical function. You need to follow the guidance.
But I think the question is that I think there are some IT companies who say my HR department is a critical office. That's not true. That's a minimum basic operation. And so you need to figure out how to maintain 10%. If you need those people to come in, then you have to figure out how to do the 10% within that. If they have to come in to do those operations, if they have to come in to do payroll, if they have to come in to do certain things.
Absolutely. Yeah. No, thank you for the clarification. Yeah, I totally understand. Sorry for going off on a tangent. Yeah. If you believe you have critical functions within, it's not really that way. Your business is the critical function or the critical business.
But if you're a bank office, which bank is now considered a critical business, you need to try to maintain as limited capacity, what you said earlier, you're going to try to maintain as limited capacity as you possibly can.
Yep.
Which, as you said earlier, and do as much as you can to follow as much limited capacity as you can.
Yep.
Okay.
Again, that Appendix A is what they need to read because it spells all the things that Jesse's mentioned over and over. So it talks about what they need to do, unless, again, it's impossible for them to carry out their functions by doing it. So
a copy of the chart that you're mentioning is at covid19.colorado.org. You click on the dial and it'll bring up that big chart. And then the order is under orders. If you're not able to find the links, it's under orders and it's under dial framework. I'll take one or two more questions and then we're going to move on to the other one, which is on retail. Let's see. We have a bunch more tennis questions. Okay. If you have any questions about your specific municipality, about the outdoor dining, curbside, those are not for Jesse or Lane. You're going to need to call your municipality as to whether or not they're extending their outdoor dining and if they have any curbside restrictions. So you'll need to
We were
ask
hoping
your
to have those answered,
municipality.
but we didn't get them. Sorry.
What category does a driving school fall under?
That's a personal service, but I would also say that there's almost no way for them to maintain 6 feet of distance in a car, unless it's a very big car, like an old Cadillac or something. So I think it's important to look at the critical business functions there, see if it might fall under that, because otherwise I'm not sure how it would operate.
Okay. All right. At this point, I'm going to, if your question wasn't answered and it's something you want, email me, corinne.waldow@boulderchamber.com. I will also send out an email with the recording of this and any links that are in here. We'll try to get your question answered. I know we didn't answer 28 of the questions thus far. We apologize. We did schedule the retail call before we knew that we were changing to red. Do have a call on Friday at 11 to answer. The change does happen at 5 o'clock on Friday. So if something comes up between now and then, please email myself or the COVID biz at bouldercounty.org to try to get your questions answered. At this time, we're going to switch over to the retail call and we will see everybody on Friday if you're able to make that call. In the meantime, stay healthy and we will hopefully not keep sending you complete different changes to every order every week. Thank you, Jesse. Thank you, Lane. We'll see you in 1 minute.
Thank you. Thanks so much, everybody.